Think about the last time you took a pill, maybe a painkiller this morning or an antibiotic last month. You just trusted it to work, right? We all do. But have you ever really stopped to think about it? What does it actually take to get that one little pill into your medicine cabinet? Well, the answer is kind of shocking. On average, it takes 12 years. Yeah, a full dozen years from some scientist's light bulb moment in a lab to that pill finally landing on a pharmacy shelf. And get this, the price tag? We're talking somewhere between $1 and $3 billion, with a B, for just one single successful drug. And here's the real kicker. For every 10 drugs that even start this crazy long journey, 9 of them will fail, a 90% failure rate. That means the pill in your hand, it isn't just a pill, it's a survivor. So why? Why is this whole process so incredibly long, so expensive, and so ridiculously hard? Well, this system we have, it wasn't just designed out of an abundance of caution. No, it was forged from an absolute disaster. We had to learn this stuff the hard way. And the story that really shows this is the tragedy of thalidomide. Back in the late 1950s, it was sold as this amazing, totally safe new drug for morning sickness, a miracle cure for pregnant women. The problem was, the safety testing was rushed and, frankly, just wasn't good enough. Just look at this timeline and you can see how fast everything went wrong. By 1958, thalidomide was already out there in 46 different countries. But then, look at the US. The company applied for approval in 1960, but 2 whole years later, it was still unapproved. So what gives? Why the holdup? Well, that delay came down to one person, an FDA reviewer named Frances Kelsey. And you can imagine the pressure she was under to just rubber stamp it. But she refused. She held her ground, kept demanding more and more safety data, and she famously said, "I have a right to be suspicious if I am not given the information I need." And that refusal, it was absolutely heroic. Because while thousands of babies in other countries were being born with devastating birth defects, Frances Kelsey's stubbornness saved countless American families from that exact same nightmare. She was quite rightly given the President's Medal for her incredible courage. So the thalidomide tragedy, it was a massive wake-up call for the entire world. It basically forced governments everywhere to say, okay, never again. They had to build a shield, a whole new system, to make sure a disaster like that could never, ever happen again. Here in the US, the direct result was something called the Kefauver-Harris Amendment, passed in 1962. And this one law basically created the system we have today. For the very first time, it said that companies had to prove 2 things, not just that a drug is safe, but also that it actually works, that it's effective. But the rules for safety go even deeper than that, and they were born from an even darker history. The absolutely horrific medical experiments conducted by the Nazis during World War II led to something called the Nuremberg Code, and this established a non-negotiable principle, voluntary consent. You have to agree to be part of an experiment. And that legacy is alive and well today in the ethics committees and the informed consent forms that are designed to protect every single person who volunteers for a clinical trial. So all of this history is what created the system we have right now. You can think of it like a gauntlet, a multi-stage challenge that every single new drug has to survive. And it's designed specifically to filter out anything that's unsafe or just doesn't work long before it has a chance to reach you. And that filtering process, it starts way early. Before a single human being is ever involved. Scientists might start by screening, say, 10,000 different chemical compounds. From that massive pool, they might find 250 that look promising enough to even move on to animal testing. And out of those, maybe 5 will be considered safe enough to even think about trying in people. Okay, so once a drug finally makes it to human testing, it enters this 4-phase process. Phase 1 starts small, with just a handful of healthy volunteers, purely to check for safety and figure out the right dose. Then Phase 2 expands to a few hundred actual patients to see, does this thing even work? Phase 3 is the big one, thousands of patients, to confirm it works and to watch out for any rare side effects. And then even after it's approved, there's Phase 4, which is basically long-term monitoring while it's out on the market. But let's go back to Phase 3 for a second. This is the great filter. This is where most drugs die. It's the ultimate showdown, testing the new drug against either a placebo or whatever the best current treatment is. And get this, only about 25 to 30% of drugs that even make it to Phase 3 will actually pass. So why is Phase 3 so tough? Because it relies on the absolute gold standard of medical science, the randomized controlled trial. It's pretty simple, really. You take a big group of patients and you randomly assign them to one of two groups. Group A gets the new drug. Group B gets a placebo, a sugar pill, or the current best treatment. By doing it randomly, you get rid of any bias and who gets what. But here's maybe the most clever, most important part. To get rid of all human bias, these trials are double-blind. What does that mean? It means neither the patient nor the doctor has any idea who is getting the real drug and who's getting the placebo. Think about it. If a doctor knows their patient is on a promising new drug, they might unconsciously see improvement where there isn't any. The double-blind method makes sure the data is as pure and unbiased as humanly possible. So, if a drug manages to survive all of that, the massive preclinical funnel, all 3 brutal phases of human trials, and the intense scrutiny of regulators, only then, after all that, does it finally get to you. I mean, just think about that journey again for a second. 12 years of work, up to $3 billion spent, a grueling 4-phase testing gauntlet watched over by ethics committees, all for a drug that had a 90% chance of failing somewhere along the way. So the next time you hold a pill in your hand, any pill, just remember what it represents. It is not a given. It's the end result of one of the most complex, most expensive, and most carefully controlled processes our civilization has ever created. And it's a process built on the lessons learned from tragedies that never should have happened. Which kind of brings us to a final question for you to think about. This entire system, this whole shield we've built, it only works because thousands of people volunteer. They put themselves on the line for the sake of science and for patients they'll never meet. So, knowing everything you know now, the risks, the safeguards, and the incredible potential benefits, would you ever volunteer for a clinical trial?